Introduction. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, commonly used for pain relief, fever reduction, and inflammation control. It is available over the counter and by prescription in various strengths. 2. Drug class. NSAID, non-steroidal anti-inflammatory drug, propionic acid derivative. 3. Mechanism of action. Ibuprofen works by inhibiting cyclooxygenase enzymes, COX-1 and COX-2. This decreases the production of prostaglandins, which are chemicals responsible for pain, fever, inflammation. Result: heavy checkmark, less pain, heavy checkmark, reduced swelling, heavy checkmark, lower body temperature. 4. Pharmacokinetics. Absorption, rapid from GIT onset, 30 minutes peak, 1 to 2 hours half-life, 2 hours metabolism, liver, CYP enzymes, excretion, kidneys. 5. Uses, indications. Ibuprofen is used for pain relief, headache, toothache, muscle pain, back pain, joint pain, minor injury pain, inflammatory conditions, osteoarthritis, rheumatoid arthritis, gout, mild sports injuries, fever in adults and children, dysmenorrhea, menstrual pain, and abdominal cramps. 6. Dosage. Adults 200 to 400 mg every 6 to 8 hours maximum, 1,200 mg per day. OTC maximum, 2,400 mg per day. Prescription. Children 10 mg/kg per dose every 6 to 8 hours max, 40 mg per kilogram per day. Forms available: tablets, capsules, suspensions, drops, IV form, in hospitals, topical gels. 7. Side effects. Common side effects: stomach pain, heartburn, nausea, dizziness, headache. Serious side effects: rare, gastrointestinal bleeding, kidney damage, liver dysfunction, increased blood pressure, allergic reactions, rash, swelling, breathing difficulty, risk of heart attack or stroke with long-term high doses. 8. Contraindications. Avoid ibuprofen in peptic ulcer or GI bleeding, severe kidney disease, severe liver disease, known NSAID allergy, aspirin-induced asthma, pregnancy, third trimester, uncontrolled hypertension. 9. Drug interactions. Ibuprofen interacts with aspirin, reduces cardioprotective effect; warfarin increases bleeding risk; diuretics reduces kidney function; ACE inhibitors/ARBs kidney risk; steroids increase GI bleeding risk; lithium increases lithium levels. 10. Precautions. SUSA with caution in elderly patients, patients with history of ulcer, kidney patients, heart disease, pregnant or breastfeeding women. Take with food to avoid stomach upset. 11. Overdose symptoms: severe nausea, vomiting, drowsiness, bleeding, low blood pressure, coma. Rare, emergency treatment required immediately. 12. Brand names. Common brand names worldwide: Brufen, Advil, Motrin, Nurofen, Ibumolibugesic.